When you have a filling in a tooth, the tooth is like a porcelain bowl, and the filling's on the inside of it. And the filling will expand and contract, and expand and contract. And sometimes it causes small cracks in the sides of the tooth that are left. Those sides of the tooth could crack or shatter, and you could lose the tooth, or have to have a gum surgery procedure to be able to restore the tooth. So what you want to do is be proactive and put a crown on the tooth. The crown holds the tooth together. So instead of the forces going from the inside out, forces go from the outside in, and you can prevent the tooth from fracturing or cracking and preserve the tooth and the health of the tooth, so that you don't have to go through additional dentistry down the road, or possibly even lose a tooth and have to have implants or bridges or whatever else is involved. Clinical studies have shown that crowns last about 19 years. Those are good crowns. Some crowns can last a lifetime, and some may not last very long at all if they're not done properly. So when we do a crown here, we make every effort to make sure that everything is done the way it's supposed to be done, so that we could be on the long end of the spectrum instead of the short end of the spectrum. I can tell you a story about a gentleman that I treated 20 years ago who came into the office a few weeks ago and told me that he needed to get his crowns all redone. And I said, why is that? And he said, well, you told me they'd last 20 years, and it's been 20 years. So I said, okay, well, let me have a look at them. And I took a look at them, and I said, I hate to disappoint you, but they're all looking pretty good, and you don't have to get them redone. So they can last for longer than that, if they're done right.